Good evening, everyone, and welcome. My name is Karishma, and I'll be your moderator for this evening's talk, titled The Importance of Gut Health on Immunity and Tolerance. If you have any questions throughout today's talk, feel free to pop them in the Q&A box on the right-hand side of the screen. Okay, I'm going to go through a short disclaimer before we begin. Breast milk is the best option for babies, and in the event that breast milk is not available, breast milk substitutes can be considered. Allow me to introduce our esteemed speaker for this evening, Professor Ann Goh. Professor Ann Goh is a senior consultant in the Pediatric Allergy Service and Respiratory Medicine Service Department of Pediatrics at KK Women's and Children's Hospital in Singapore. She is a clinical professor at the Duke NUS Graduate Medical School and associate professor of the Lee Kong Chian School of Medicine and the Yong Lu Lin School of Medicine. Prof. Goh is a reviewer for several prestigious journals, author and co-author of numerous peer-reviewed papers, and is actively involved in clinical trials. Her clinical and research interests include allergic gastrointestinal disorders, food allergies, and respiratory conditions. So without further ado, I'd like to hand over the floor to Professor Ann Goh, who will take us through tonight's talk. Prof, over to you.
Thank you, Kamisa, for that kind introduction. Right. And I'm going to talk about the importance of gut health on immunity and tolerance. Whenever we think of the gut, we tend to think of it in terms of its function for digestion and its absorption of food. And we don't really think about it for its immune function. However, it does have a very important role in immune function because it also plays a role in preventing the gastrointestinal infections and more importantly, particularly in very young infants, the development of tolerance to food. Because if you really think about it, to babies, every food is new. And if we never were able to develop tolerance, then we would be allergic to many, many foods. So this interaction between the gut and the gut microbiome plays a very important role in developing this immune function and tolerance. And it is through immune or innate immune receptors such as toll-like receptors which help in the maturation of this immune development, such that babies are able to develop tolerance to food and babies are able to develop immunity against gastrointestinal infections. And any disruption to this gut microbiome therefore can lead to an imbalance and disrupt this ability to develop tolerance. So the gut microbiome is achieved in the baby through, at birth, through acquisition of gut microflora from the mother as it passes through the vaginal canal through normal vaginal delivery. And therefore, if you look at the gut microbiota in a normal vaginal delivered baby, it consists mainly of vaginal flora as well as fecal flora from the mother. However, when the baby starts to feed, maternal breast milk, as we've heard, is the best way of feeding babies, then babies also acquire the microbiome from the skin as well as the breast milk of the mother. So therefore, you find that the very important initial colonization of the gut microbiome consists of microflora that come from the maternal vaginal vagina as well as from breast milk as well as maternal skin around the breast. And if you look at the colonization of the bacteria soon after birth, you'll find that the main bacteria that is found in the gut microbiome is bifidobacteria. And this is very much influenced, therefore, by the mode of delivery as well as the mode of feeding. So I'm going to go through why mode of delivery influences it. And I've already mentioned to you that obviously when in most instances babies are delivered vaginally, and therefore they are going to acquire the microflora from the mother's vaginal system. However, babies delivered by cesarean section will have a very different microbiota, because now they are no longer going to be getting microflora from the vagina, but it's mainly maternal skin flora that will be colonizing the baby's gut. And what they found in infants that are delivered by cesarean section, the main organisms are skin organisms, whereas, as I've mentioned, those delivered vaginally will be from the vaginal. And therefore, if you look at those born vaginally, what is being found is that the microbiota consists of very high numbers of Bacteroidetes species as well as Actinobacteria, especially when you compare that to those delivered by cesarean section, which would therefore consist mainly of skin flora, which is mainly Streptococcus, Staphylococcus, as well as Haemophilus. So these species that you will find in the gut microbiome will be very, very different. And they have cesarean delivered infants have a much lower accumulation of Actinobacteria in their gut. If we look at, therefore, at Bifidobacterium, which is the organism that is found most commonly in vaginally delivered infants, when you look at cesarean delivered infants, they have very low levels of Bifidobacterium, and it takes them a very long time to acquire the same level as vaginally delivered babies. So in this particular study, you can see that it takes almost 6 months before the levels of Bifidobacterium is the same as that of a vaginally delivered infant in that of a in that cesarean delivered infant. Okay. So there's firstly a low levels of Bifidobacterium, and there's delayed colonization of Bifidobacterium in cesarean delivered infants. The other difference, obviously, when you look at vaginally delivered infants, is that they also manifest very high levels of organic acids, such as short-chain fatty acids, which is seen here. Lactic acid are found definitely a lot more prominently in infants that are delivered vaginally. And this is mainly because short-chain fatty acids are metabolite of the bifidobacteria that is found in the gut. So if you look at breastfeeding as well, these children who are breastfed have again an abundance of bifidobacterium in their gut as compared to infants who are formula fed. And when one looks at the components of breast milk, one of the major components that is found in human breast milk is the human milk oligosaccharides, besides many of the other bioactive components that are found in breast milk, which will contribute to immune development as well. Lactoferrin, for example, will contribute as well as serum IgA, secretory IgA, have play lactoadherin, play major effects on development of immunity for the infant. However, if one looks at the one major component, human milk oligosaccharide is actually very commonly found in human breast milk. So is there this link between human milk oligosaccharides and these high levels of bifidobacteria that is seen in most of these infants? What has been demonstrated is that bifidobacterium is able to consume human milk oligosaccharides, and this ability to consume or assimilate human milk oligosaccharides is very species specific, bacterial species specific. So if you can see here, what I've shown in this chart is that it's mainly bifidobacterium that is able to do this. Okay, and that accounts for why there's such high levels of bifidobacterium that is found in the infant gut, because they do need it to utilize the human milk oligosaccharide in helping it in its immune development of the gut. And you see this very clearly too, that bifidobacteria, as I showed you in the earlier chart, increases tremendously very soon after birth, and is very high in infancy, and it decreases with age, becoming less prominent as the child gets older. But it still plays a fairly major role as a gut microbiome, gut organism in the gut microbiome. So it's still one of the more common organisms that are found in the gut. And so what breast milk does is that it not only has obviously human milk oligosaccharides, which enables the gut microflora to thrive, particularly the good gut microflora that enables a healthy gut microbiome, but it also contains multiple immune factors and bioactive components, which not only helps in the growth of the child, but in the development of the immunity, immune system of the infant. So what's the role of human milk oligosaccharide in the gut? Besides the fact that it stimulates the growth and colonization of commensal bacteria such as bifidobacteria, it also modulates the formation of metabolites, as I've mentioned, such as the short-chain fatty acids, which play a major role in acidifying the gut and increasing the pH within the gut. That leads to also an important role in reducing infections in these infants. It also reduces pathogenic infections by acting as decoy receptors, and it stimulates epithelial cell maturation. So it plays multiple roles in the maturation of immune gut function. Hence, breastfeeding, as you can see, therefore, will lead to reduction in the risk of infections, because if breast milk improves the child's immune development as well as gut immunity, then it is able to reduce gastrointestinal infections as well as respiratory infections. And this has been clearly demonstrated clinically as well, that children or infants who are breastfed have lower incidences of diarrheal as well as respiratory infections. I'm going to touch on antibiotic use, mainly because antibiotics are so commonly prescribed, particularly to children as well as infants. We know that children suffer a lot from recurrent viral respiratory infections, and they also are at higher risk of gastrointestinal infections, commonly caused by many viral as well as bacterial pathogens, right? Breastfeeding, we know, protects. However, very often antibiotics still tend to get prescribed. And the effect of antibiotics has a major impact on the gut microbiome. It causes a reduction in Firmicutes and the persistence of Bacteroidetes as well as Proteobacteria in the gut. Proteobacteria are organisms such as Enterobacter, Salmonella, as well as E. coli. So as you can see, these are not the good bacteria. And multiple causes of antibiotics actually are going to have a detrimental effect on the gut microbiome. And they also have a reduction in bifidobacteria with the use of antibiotics. This shows the impact of early life antibiotic on the gut microbiota development. This was in very young infants who were given antibiotics who were delivered by cesarean section, and we already know that with a cesarean delivered infant, they already have an abnormal gut microbiota, and if antibiotic treatment is added to that, there is a greater impact on the biodiversity of the gut microbiome. And what this study showed was that the effect of the antibiotic persisted for up to 6 months before recovery of the gut microbiota and the recovery of bifidobacteria levels to that of a pre-antibiotic level. So antibiotics are not good if they are used inappropriately. Antibiotics also result in a reduction in interferon gamma as well as interleukin 17A production, and this too has an effect on the bacterial enteric bacterial infections, okay, which predispose these infants who are receiving antibiotics to subsequent gastrointestinal infections as well. Okay. This is a meta-analysis looking at the prenatal use of antibiotics in pregnant women. And what they found was that this was associated with an increased risk of wheezing in the offspring, particularly if antibiotics was given in the 3rd trimester of pregnancy. And if you look at infant antibiotic use, there was a similar association with an increased risk of wheezing. So antibiotic use with the disruption of the gut microbiota not only predisposes the infant to increased infections, they also predispose the infant to an increased risk of wheezing and possibly to the development of asthma. So what I've shown you in this short few minutes is that there are multiple factors which can impact the gut microbiota as well as the immune system in early life. The major components that do this obviously will be the mode of delivery, and if possible, most babies should be delivered vaginally and not through cesarean section unless medically indicated, because the cesarean delivered babies will have a disruption in their gut microbiome. Again, the mode of feeding is important, as I've demonstrated to you, and breast milk, as I've shown, is best, and most babies should be breastfed. And if that can't be done, then yes, alternative modes of feeding can be offered, but breast milk is still the best for its various components found within breast milk. We should be careful about the use of antibiotics, and we should definitely be judicious about its use because it can disrupt the gut microbiome, leading to its effects on the immunity as well as allergy development. So the gut microbiome definitely plays a very important role in the development of a healthy immune system, and a disruption, as I've demonstrated to you very briefly, can result in metabolic or allergic conditions, as well as immune-mediated diseases. So are there strategies that we can use to modulate the gut microbiome if a disruption has occurred towards a more healthy microbiome? And I'm going to go through very quickly the use of human milk oligosaccharides, probiotics, prebiotics, synbiotics, and vitamin D. So I've already mentioned the importance of human milk oligosaccharides, and now the human milk oligosaccharides can be developed and can be added to formula. And what they found is that infants fed formulas with a human milk oligosaccharide, the commonest being 2FL, have a gut microbiota which is very similar or closer to that of a breastfed infant when you compare that to, say, an infant that is fed a standard cow's milk formula. They've also found that infants fed formula containing human milk oligosaccharide, in this instance 2FL, had fewer respiratory tract infections compared to infants fed a standard cow's milk formula. So and definitely the human milk oligosaccharide that is being developed and added to formula behave in a very similar fashion to that found in breast milk, and do have some impact in reducing infections from when added to formula. This is another study that's shown that again, human milk oligosaccharides added to formula, in this instance 2 human milk oligosaccharides, 2FL and LNNT, showed a reduction in respiratory tract infections such as bronchitis, lower respiratory tract infection, and very importantly, a reduction in antibiotic use. And what about probiotics, prebiotics, and synbiotics? So what are probiotics? They are used to control the growth of potentially pathogenic bacteria in the gut by increasing the beneficial bacteria and restoring the metabolic activity. Such examples of which obviously will be bifidobacteria or lactobacillus. Prebiotics are complex carbohydrates which provide nutrition for the growth of beneficial bacteria in the gut, such as bifidobacteria and lactobacillus, which increase the colonic production of short-chain fatty acids that decreases the gut pH, which decreases the growth of pathogenic bacteria. And synbiotics are a combination of both pre and probiotics. So when looking at the use of probiotics in this particular study in infants with cow's milk allergy, what they found that when these infants were randomized to receive extensively hydrolyzed formula with or without a probiotic added, in this instance Lactobacillus GG, the group that received the extensively hydrolyzed formula with the probiotic had a faster remission of symptoms for both, and the acquisition of tolerance in both in those with IgE as well as non-IgE mediated cow's milk allergy, compared to just an extensively hydrolyzed formula alone. With prebiotics in this particular study, supplementation with a prebiotic to a formula in a high-risk group of infants showed a reduction in eczema through increasing the short-chain fatty acid such as butyrate production in the gut. So again, there may be a benefit in reduction of allergic diseases, particularly eczema, in this instance when a prebiotic was supplemented to a partially hydrolyzed formula in this particular study compared to a standard cow's milk formula. In another study called the PIPA study, again, infants were fed a prebiotic-enriched formula supplemented with gauze and polydextrose for 48 weeks. And what they found was that these infants had less respiratory infections compared to infants fed the standard cow's milk formula. However, what they found was that once the formula was stopped, then this effect was no longer seen. However, when they looked further, they were able to demonstrate that the prebiotic enriched formula actually showed a reduction in recurrent respiratory tract infections and wheezy lower respiratory tract infections, which were very similar to that of breastfed infants compared to a standard formula. So there was still some benefit of supplementation with the prebiotic formula, despite the fact that the effect seems to have worn off after stopping. The use of synbiotics was demonstrated in this particular study. As I've mentioned earlier, in this study, what you see here is that cesarean-delivered infants have a delayed colonization with bifidobacteria. So, and it took these infants as much as 4 to 6 months to achieve the same level of bifidobacterium compared to a vaginally delivered infant. So in this study, the Julia study, these cesarean delivered infants were fed a symbiotic supplemented formula, and what they demonstrated here was that a symbiotic supplemented formula was able to achieve the same level of bifidobacterium as a vaginally delivered infant. That's the symbiotic formula is the one in green, and the vaginal delivery is the black, and you can see it's very similar. Whereas if you had just C-section alone, bifidobacteria levels were low, and that's the one in pink. And if it's just prebiotic alone, you still had insufficient levels of bifidobacterium. So a combination of a prebiotic, in this instance was Gosfos, with Bifidobacterium brevi, was able to restore the bifidobacterium to very similar to a vaginally delivered infant right from the beginning. And in this particular study, again, what they demonstrated was that eczema appears to be lower in the symbiotic supplemented group compared to the control group. Okay, I'm going to talk about vitamin D. Vitamin D enhances cellular innate immunity through induction of antimicrobial peptides such as human cathelicidin and defensins, and it also modulates the adaptive immunity. It helps to maintain integrity of tight junctions, gap junctions, and adherent junctions of cells, and it enhances the expression of genes related to antioxidants, which enhances the effect of vitamin C, which may have antimicrobial activities. So we see here that vitamin D has many functions which may help to improve immunity. So if you look at this meta-analysis showing vitamin D supplementation, it showed that vitamin D supplementation significantly reduced acute respiratory tract infections in many of these studies. And the greatest benefits seen were obviously those with lower levels of baseline 25-hydroxy vitamin D levels. In other words, those who were vitamin D insufficient or deficient, they benefited most from vitamin D supplementation. So normal levels of vitamin D is very important in maintaining good immunity. And when one looks at severe eczema, again, these children had a very high likelihood of vitamin D deficiency. In this particular study that was published in the Internal Journal of Dermatology, you can see that those with SCORAD scores of more than 50, which demonstrated severe eczema, they had much lower levels of vitamin D compared to those with milder eczema, and also compared to controls. And this may be also related to the fact that polymorphisms of vitamin D receptors are seen on skin keratinocytes, and this lack of vitamin D may therefore increase the risk of eczema. And the expression of the synthesis of filaggrin, which we know is important in the development of integrity of the skin barrier, is regulated by vitamin D. Hence, if there is vitamin D insufficiency or deficiency, these effects may be affected, both in the development or synthesis of filaggrin as well as in the vitamin D receptors on skin keratinocytes. So when one looks at this meta-analysis of the serum 25-hydroxy vitamin D levels in patients with atopic dermatitis or eczema. They were demonstrated to be lower than healthy controls. And when vitamin D supplementation was given, many of these patients had an improvement in their atopic dermatitis. And the mean dose of vitamin D that was required for supplementation was between 1,500 to 1,600 international units per day. So I've taken you through in the last half hour or so that the gut microbiota definitely plays an important role in immune development as well as gut health, and a dysbiosis from a disruption of the gut microbiota has long-term health consequences, both in immune function as well as the development of allergic as well as metabolic diseases. Breastfeeding and vaginal delivery and a reduction in the use or judicious use of antibiotics are useful to maintain a healthy gut microbiome. And strategies that may help to modulate the gut microbiota when dysbiosis has occurred will include the use of supplementation with human milk oligosaccharides, probiotics, prebiotics, and synbiotics, and vitamin D, particularly in the presence of severe eczema in those who are vitamin D deficient. Thank you.
All right, wonderful. Thank you so much, Prof. Ango, for your insightful talk. Definitely learned a lot about symbiotics, probiotics, prebiotics, especially vitamin D. I'm just looking through the Q&A to see if there are any questions from the audience. So for those listening, feel free to pop your Q&A into the box on the right-hand side of the screen next to the chat button. And also keep the emotions coming. I see lots of love, congrats, and happy faces in reaction to Prof. An's speech. Wonderful. Thank you so much. Okay, maybe I'll just kick us off with a question. I was just thinking about translating this into practice. So is there anything specifically that you're currently doing, Prof, to translate some of this research and evidence into the care you give to your patients or their families?
Okay, I mean, definitely, I would say encourage breastfeeding, and I think particularly in Singapore, I think there's a very strong push for breastfeeding, and happy to say I think our breastfeeding rates have gone up quite a lot compared to say 10 years ago. Many parents, many mothers realize the importance of breastfeeding, and they are trying very hard to breastfeed their children. So yes, breast milk is still the best for most infants. We would definitely want to encourage that most mothers deliver vaginally, rather than opt for elective cesarean sections. For example, I've already shown you that definitely cesarean sections do disrupt the gut microbiota, or rather, you're acquiring very different microbiota organisms when you're doing a cesarean section as compared to, say, a vaginal delivery. And so, yes, deliver the babies vaginally rather than cesarean section, unless there's a medical indication. Then, of course, yeah. For the safety of both mother and baby, then if a cesarean section is needed, yes, go ahead and get it done. Definitely, we will not want to compromise on safety, and that's still very important. Antibiotics, I think, is a big problem. I think there's still a huge overuse and misuse of antibiotics, and I think that's why I touched on it, because I strongly feel that we could possibly be a little bit more judicious in our use of antibiotics, because many of the infections that the children get are still viral in nature. Um, and definitely we know viral infections do not require antibiotics, you know. So even though sometimes fever can go on for a little longer, if they look still like a viral infection, it doesn't warrant giving out an antibiotic just for that. Yeah. Uh, is there? I think there are some questions in your Q&A.
Sure. I wasn't sure if you're done or not. Okay, great, wonderful. Yeah, so I think we get the message loud and clear. Breast milk is best, and of
Yeah.
course, the vaginal delivery as well. Of course, unless safety is compromised, then there are other alternatives. Yeah, thanks. Okay. Unfortunately, I can't see any Q&A on my screen. Okay, great. I think our tech support has helped us flash it up. Okay, so Go, do you recommend vitamin D supplementation in infants to improve immunity? And also in your practice, do you prescribe vitamin D to your patients?
Okay, so I'm actually beginning to check for vitamin D deficiency in some of these patients with very severe eczema, bit more regularly. And I do find that many of the patients with severe eczema are vitamin insufficient or deficient. And definitely they will benefit from vitamin D supplementation. I wouldn't say that I routinely supplement all infants with vitamin D. I do not really do that in practice. If the infant is well thrived, there's no real indication to supplement everyone with vitamin D as such. Yeah.
Okay, so it's like a case by case basis. You'd assess the need for it. Then
Yes, yeah. I mean, most infants, if they're initially breastfed, and I know even though some people will recommend that, you know, maybe they should get supplemented, it is not routinely done still. Yeah, for all infants who are breastfed. Yeah, but as long as maternal diets are good, they probably mothers should. The other important thing is that mothers probably should have a good healthy diet and healthy lifestyle right from pre-pregnancy and right through pregnancy, as well as through lactation. So that actually helps in maintaining a healthy gut microbiota for the infant. Yeah, okay, because it really starts way before the mother becomes pregnant and do all right through pregnancy. Yeah,
yeah, yeah, really starts from the mother, definitely.
yeah,
Great,
yeah.
thanks. I think there's another question on a similar topic on vitamin D. What is your opinion on universal prophylactic and preventative vitamin D supplementation in breastfed and formula-fed infants? It's normal
I think I
infant.
can say, yeah. So I mean, basically, at the current moment,
Like,
I have not really seen that it's been like universally a necessity to supplement everyone, as I said.
mm,
Um,
yeah.
um, uh, the appropriate time to wean is also important.
Mm-hmm.
Okay, because sometimes mothers get so carried away with the breastfeeding, they forget that weaning is also very important. The to appropriately introduce solid food to the infants and not delay it for too long. Okay, so the current recommendation, definitely for allergies or allergy prevention, we are saying introduce between 4 to 6 months uh, of the infant's age. as long as the child is ready to accept solids, right? And
Mhm.
it and that's also important because obviously then when once you start introducing some solids in the child's diet, you will be giving them some of these other micronutrients which we know breast milk may not be as rich in.
Mhm.
So in a way, for that few months it may still be okay not to have to require universal supplementation, as long as firstly the mother starts off fairly well nourished, and the breast milk will be therefore adequate to a certain extent to tide the child to the point where the child gets weaned in an appropriate manner. Yeah. So and so I guess it's really the entire journey of, making sure you're healthy, live, eat
Mhm.
well,
Yeah,
exercise well,
food is
right?
good. Yeah,
Right before you become pregnant, and
yeah,
then
yeah,
the optimal
yeah.
profile for having a good,
Mhm.
healthy baby. Yeah.
Mm-hmm. Yeah, yeah. I think it's really a holistic picture, right? I think it's not just one aspect, but it's like the diet, the lifestyle, the mental well-being
Mm,
as well. All that passes down to the children, and start
yeah.
food first where possible. Yeah. Okay. Great. Wonderful. Thanks. So I think now moving on to antibiotics. Question is how much antibiotics is considered to give bad effects on the normal gut microbiota? And also, is it all kinds of antibiotics, or is there any specific antibiotics that might cause this effect, disrupt the normal gut microbiota?
Yeah, so I mean, I would say almost all antibiotics are bad. Is There may be some, and I guess the impact of the antibiotic is very much also based on the dose and the duration, and
Yeah.
the kind of antibiotic that you're using. Because if it's a very broad spectrum antibiotic, then obviously you are going to have a wider impact on the microbiota. And of course, the longer duration of the antibiotic, that impact is going to be longer lasting as well. So and that's why I think wherever we say, when you choose an antibiotic, um, choose the narrowest spectrum antibiotic that you can find, and for the shortest duration that will be needed to adequately treat the infection. Okay, so it's not the wider the spectrum, the longer the duration is better. In fact, probably the reverse is true. You probably want the shortest duration and the narrowest spectrum antibiotic, so that you minimize all the bad effects of the antibiotic as much as possible, but still get the infection under control. And also it reduces the problem of the antibiotic resistance developing. Yeah.
Yeah. Okay. Great. Thanks. Um, ooh, similar question. Is there a recommendation for those with strep B positive and receive preventative antibiotics during delivery?
Okay. I don't think anybody has ever come up with a recommendation
Okay.
for this. Definitely for those who are the mothers are strep B positive, then they will need to receive antibiotics. And if the babies are infected, of course, they will need to receive antibiotics. Can you do something if the baby has received antibiotics to try and reduce the impact of antibiotics? I guess it is possible to give some probiotics in a way to um, correct some of the dysbiosis as far as possible. Um, and that may definitely help to reduce the duration where the impact on the gut microbiome may have uh, had an yeah that the antibiotic had an effect on. Yeah.
Yeah.
So I think many times I think people do try to give some probiotic after they've given a course of antibiotics to help to kind of
Yeah.
correct the
Right.
dysbiosis. Yeah.
Yeah, correct. I think it's a very big, I don't know, it's a common practice I've heard. Patients and
Yeah.
families do share that. Yeah,
Mm.
probiotics is usually given after antibiotics to sort of reverse it or improve the microflora. Yeah.
Yeah. But I guess the best thing is just don't use too much antibiotics because
Yeah,
whatever it
correct.
is, it still takes a long time for the gut to recover. Yeah.
Exactly. Yeah, I think it's interesting what you said, the narrower spectrum and the short duration. Yeah, so you're very targeted and focused on what you're trying to treat as opposed to just being broad. Yeah.
Mm.
Okay. Another question, similar stream. So for adults who grow up with a low immune system and frequent infections and unhealthy microbiome, will the intake of pre and probiotics as well as vitamin D supplementation help to reverse that? I suppose reverse the low immune system and reduce the frequency of infections.
Mm. So
What are your thoughts
okay,
on
so
this?
here you're looking at an adult with with a low immune, okay, with who is a bit immunocompromised.
Yes,
Is that what
I would,
I would gather
yeah,
from this?
understand from this. Yeah, frequent infection,
Yeah.
unhealthy. Yep, yeah.
Mm.
Mm.
Okay. I mean, because when you're talking about unhealthy microbiome, then you want to know also what caused this unhealthy
Mm.
microbiome.
Yes.
Was it an underlying disease that was the problem, or was it the bad lifestyle? Because obviously, when you're talking about adult, it is a bit hard to say. I mean, there are obviously many contributors, right, to unhealthy microbiome. I've when you talk about unhealthy lifestyles, obviously smoking, drinking, especially in adults, contribute to all this, um, and unhealthy diets contribute to it as well, right? So, um, can we correct it with the use of prebiotics and symbiotics and vitamin D? I guess if it was a lifestyle issue, I think we have to change the lifestyle and it's not taking more
Good call.
supplements. Yeah.
Yeah.
If it was an underlying problem of a disease, then obviously the disease needs to be managed and treated.
Mm.
If there is a identifiable deficiency or micronutrient deficiency like vitamin D deficiency, then yes, supplementing with vitamin D will help. Definitely, we want to correct vitamin D deficiencies because it will definitely benefit the individual when vitamin D levels become normal. Um, so I it's a kind of a broad question because it really depends on what triggered that
Mm.
unhealthy microbiome in the first place. Yeah. Uh, and I guess for short term, yes, you probably could use a probiotic, but I think if you're thinking long term, then you do need to look at what was the underlying cause of that unhealthy
Mm.
microbiome in the first place. Yeah.
Yeah, definitely agree with that. Yep, definitely.
Yeah.
Really, back to the root cause, right? I think
Yeah.
trying to figure out how it all started. Yep, yeah, instead of just
Mm,
piling on the supplements. Mm-hmm.
mm,
Okay, wonderful. I think the group is really interested in supplementation, especially with probiotic and prebiotic. We have
mm.
another question on similar lines. So I think here we're comparing fermented food. So someone commented that isn't some fermented food, because some fermented food have probiotics, but it's not actually classified as a probiotic due to a difference in the concentration levels. So should we be consuming probiotic and prebiotic supplements, or is food sufficient? I think that's kind of what I gather from this question.
Okay, so actually, when you talk about fermented food, they are classified now under postbiotics. So there's actually another classification, which is a
I know that.
postbiotic.
Oh,
Yeah.
okay.
So besides pre and probiotics,
Yeah,
prebiotics,
so,
symbiotics, they actually have postbiotics, and fermented foods actually fall under postbiotics. They are
mhm.
still they are still useful. The fermented foods actually have been demonstrated to be to have health, good health implications. Um, so that's why the some when people look at the Japanese and they say, oh, why do Japanese live so long? And I mean, they do eat quite a fair bit of fermented food, miso.
Mm.
The Koreans have their kimchi, and
Yeah.
then your yogurts are all
Mm.
classified as healthy, right? And that's mainly because
Correct.
they do have some benefit in terms of improving the gut health. Yeah.
Mhm. Yeah. Okay, wonderful. Thanks. Interesting learning.
Mm.
I'm now going to research more about postbiotics. I didn't know that terminology. So
Uh,
great to have learned that. Thanks. Okay, I think again on probiotics, what is your opinion on probiotic supplementation, especially for those post antibiotic therapy? I think we talked some about it earlier a little bit. I think they're
yeah.
asking specifically about mono or multi type. Yeah, one is better than the other.
Well, I don't think anybody has ever looked whether if you supplement with a mono probiotic, like say just one versus multiple organism type probiotic, whether one is better or multiple is better. No studies have really looked at it. I mean, definitely, there are some studies that show that there is some benefit from supplementing with probiotic post antibiotics. So, for example, diarrhea infections, and supplementing with probiotics with after antibiotic induced diarrhea, for example, has been shown to be beneficial. So there is some evidence, but whether you use a single probiotic or a combination probiotic is probably not so well defined. Yeah.
Yeah. Okay, wonderful. Thanks. Okay, I think we'll take this as the last question because we're drawing to an end of the session this evening. Can probiotic supplement consume? Oh, can you consume probiotic supplement right after you finish antibiotics? Okay. I think we mentioned it earlier. You can, but is it?
Yeah, you can. You can. There's
Yeah.
no reason to why you can't consume a
Mm,
probiotic. Yeah.
yeah. Okay. There isn't like a duration to wait before you consume
No.
probiotics.
Yeah.
No. Okay. Okay. So once the course of antibiotics is over, you can have your supplements. Mhm. Yeah. Okay, wonderful. Great. Thank you so much, Prof. Ann, for your insightful information and sharing. Lots of rich learning, and I'm sure the audience has really benefited from today as well. So thank you everyone for participating in today's webinar. Keep your emotions coming. I see lots of hearts and claps for Prof. Ann. Really appreciate that. It's just a good response for today's talk. Okay, so what's going to happen now before we end the session is that we will have a evaluation form for you to complete, and those who complete the evaluation form will get the attendance certificate for this evening's talk. Okay, so we kindly request that you do not shut down your browser because once the talk ends, a pop-up screen will appear and you can then complete the evaluation form, after which you will get your certificate of attendance. All right, thank you everyone. Can we give another round of applause to Prof. Ann? I know it's virtually, but it's okay. I'm clapping on my end here. You can type in the chat or keep the reactions coming. We really appreciate your time, Prof. Ann. And have a wonderful evening, everyone.